Have you ever noticed that something which once felt natural and effortless now feels uncertain, almost distant, even though your desire and intention have not changed? That quiet shift can be confusing, and for many men, it's something rarely spoken about. I'm Dr. James, and for over 3 decades, I've worked closely with men over 60, helping them understand the changes their bodies go through and how to respond to them with clarity and confidence. What I can tell you is this: you are not alone. Many men continue the same habits they followed in their 40s or 50s, unaware that the body no longer responds in the same way. In this video, I'll walk you through what is really happening beneath the surface and how to gently support your body so you can feel more connected, steady, and confident again. Because what most men don't realize is that one small daily habit, something you may already be doing, could be quietly working against you without you even knowing it. 1. The real issue. It's blood flow, not age. As we continue this conversation, I want you to pause for a moment and consider something that many men in their 60s and beyond quietly carry but rarely say out loud. You may have told yourself, this is just part of getting older. You may have even tried to accept it, brushing it aside as something inevitable. But deep down, there is often a lingering question: why does my body feel different when my mind still feels the same? In my years working with older men across the United States, I've seen this pattern again and again. Men who are otherwise active, who take their medications, who try to eat well and stay independent, yet begin to notice subtle but meaningful changes. It may start with a loss of morning signals, a decrease in responsiveness, or a growing hesitation in moments that once felt natural. These are not just physical changes. They often come with a quiet emotional weight, uncertainty, self-doubt, and sometimes even a sense of loss that is difficult to explain. The truth is, what you are experiencing is very often not about age itself. It is about circulation. Over time, the blood vessels, especially the smaller, more delicate ones, begin to lose flexibility. They do not open as easily, and the flow of blood becomes less efficient. This process happens gradually, often without clear warning signs, which is why so many men are caught off guard when the changes become noticeable. When this is misunderstood as simply getting old, many men stop looking for answers. They may withdraw, avoid certain situations, or lose confidence in their own bodies. But when you understand that this is a vascular issue, something begins to shift, because circulation can be supported, it can be improved. And this is where our discussion becomes important, because once you understand that blood flow is the foundation, the next question becomes, what actually helps your body restore it, and why some of the habits you trust may not be doing what you think they are. 2. The body responds to blood, not effort. Now that you understand this is not simply about age but about circulation, there is something even more important to clarify: how the body actually works in this area, and why so many men misunderstand it for years. Many men I've spoken with, especially in their 60s and 70s, quietly believe that if something isn't working, it must mean they've lost strength, or that something personal has changed within them. That belief can be heavy, and over time, it can affect not just physical confidence, but emotional connection as well. But medically speaking, the penis is not a muscle you can push into action. It is a vascular structure, meaning it depends entirely on blood flow. When the body receives the right signals and the blood vessels are able to open properly, blood fills the tissue and creates firmness. When that flow is reduced, even slightly, the response becomes weaker or inconsistent, no matter how strong the desire may still be. This is why so many men feel confused. You may still feel present, still engaged, still connected to your partner, but your body does not follow through in the same way. It's not a failure of will, and it's not a reflection of who you are as a man. It is a reflection of how efficiently blood is moving through very small, sensitive vessels. If this is misunderstood, many men begin to withdraw or avoid intimacy altogether, not because they don't care, but because they fear disappointment or embarrassment. That quiet withdrawal can slowly create distance, even in long and loving relationships. But when you begin to see this clearly, as a matter of circulation rather than identity, it opens the door to a different kind of response. It allows you to focus on supporting the body instead of blaming it. And this brings us to an important point, because even men who believe they are supporting their health may still be missing a key piece of the puzzle. 3. Olive oil alone does not activate circulation. And this is where many well-intentioned men begin to feel confused, even discouraged, because they believe they are already doing the right things. You may be someone who has switched to healthier foods, who uses olive oil instead of butter, who tries to follow what you've been told is a heart-friendly diet. These are good choices, and they matter. But when it comes to restoring circulation in the smaller blood vessels, especially as you move through your 60s and beyond, olive oil by itself does not provide the full support your body now requires. I've had many patients across the US tell me the same quiet frustration. They say, "Doctor, I'm eating better than I did 10 years ago. I've cut back on processed foods. I'm doing what I'm supposed to do, so why does my body still feel like it's slowing down?" That question often carries more than curiosity. It carries doubt, and sometimes a quiet fear that nothing will make a difference. The medical reality is that olive oil plays more of a protective role. It helps reduce inflammation and supports overall vascular health, but it does not actively trigger the widening of blood vessels. It maintains, but it does not activate. And at this stage of life, when the body's natural signals have already begun to decline, maintenance alone is often not enough. If this distinction is not understood, men may continue relying on a single habit, expecting a result that never fully comes. Over time, that gap between effort and outcome can lead to discouragement, and some may begin to believe their situation is permanent. But the truth is, your body is not unresponsive. It is simply missing a key signal. And once you understand what that signal is and how to support it, you begin to see why certain combinations matter more than individual habits alone. 4. Nitric oxide, the key that opens your blood vessels. So when we say the body is missing a signal, what we are really talking about is something called nitric oxide. You may not have heard this term before, but it plays a quiet and essential role in how your body functions, especially as you move into your 60s, 70s, and beyond. Nitric oxide is the compound that tells your blood vessels to relax and open, allowing blood to move freely where it's needed. In younger years, your body produces this naturally and efficiently. You don't think about it. Things simply work. But over time, due to aging, lifestyle, and even common conditions like high blood pressure or elevated blood sugar, the production of nitric oxide begins to decline. This doesn't happen overnight, which is why many men don't notice it until the effects become more obvious. What you may feel is not just physical change, but a quiet uncertainty. You may begin to question your body, wondering why it no longer responds the way it once did, even when your mind and emotions are still present. That disconnect can be deeply frustrating, and for some men, it leads to hesitation or avoidance in moments that once felt natural and reassuring. If nitric oxide is low, the blood vessels remain tighter than they should be. Blood flow becomes limited, especially in the smallest arteries. And when that happens, no amount of effort or intention can compensate for what is essentially a chemical signal that is no longer strong enough. Understanding this is important because it shifts the focus away from self-blame and toward physiology. It also helps explain why simply eating healthier or staying active may not fully restore function on its own. The body needs support at a deeper level, specifically in restoring this signaling process. And this brings us to a practical and often overlooked question: what actually helps the body increase nitric oxide naturally in a way that fits into daily life and supports long-term health? 5. Vinegar as the switch that activates nitric oxide. Once you understand that nitric oxide is the signal your body has been missing, the next question becomes very practical. What can actually help your body restore that signal in a simple, sustainable way? This is where something surprisingly familiar begins to matter more than most people realize: vinegar. For many men in their 60s and beyond, vinegar is nothing new. It's something you may have used occasionally in cooking or salads, never thinking of it as anything more than a flavor. But from a physiological standpoint, vinegar contains acetic acid, which has been shown to support the body's ability to stimulate nitric oxide production. In simple terms, it helps send the message your blood vessels have been waiting for: the message to relax, to open, to allow blood to move more freely. What makes this especially important at your stage of life is that the body no longer sends this signal as efficiently on its own. You may be doing everything right, taking your medications, watching your diet, staying active, but still feel like something is missing. That quiet frustration, that sense that your body is not responding the way it used to, often comes back to this exact point. The signal is too weak. Vinegar also plays another role that many men overlook. It helps stabilize blood sugar after meals, which protects the inner lining of your blood vessels. Over time, repeated spikes in blood sugar can damage these delicate linings, making it even harder for nitric oxide to do its job. By supporting this balance, vinegar helps create a more favorable environment for circulation. But this is not about using it randomly or expecting immediate change. It's about understanding that small, consistent signals, repeated daily, can help the body respond again. And when you begin to restore that signal, something important shifts. Because once the vessels begin to open more effectively, the next step is not just activating the system, but supporting it in a way that allows those changes to last and build over time. 6. Combining vinegar and olive oil creates a stronger effect. So once the signal begins to return through nitric oxide, the next step is just as important, supporting that signal so it doesn't fade. This is where many men unknowingly fall short. They may begin using vinegar and expect a noticeable change, but without the right support, the effect can feel inconsistent or temporary. The body needs not only activation, but also protection and stability. This is where olive oil comes back into the picture, but in a different role than most people expect. As we discussed earlier, olive oil on its own helps protect blood vessels, but it doesn't activate them. However, when it is combined with vinegar, something more complete begins to happen. Vinegar helps open the vessels by supporting nitric oxide, while olive oil provides the healthy fats and antioxidants that help protect the inner lining of those vessels from further damage. For men in their 60s and beyond, this combination becomes especially meaningful. At this stage of life, the body is more sensitive to inflammation, oxidative stress, and long-term wear on the vascular system. When blood vessels are both opened and protected at the same time, circulation becomes more stable, not just momentarily improved. Many men I've worked with describe this shift not as something sudden, but as something they begin to feel gradually. A sense of warmth returning, a bit more ease in the body, a subtle but noticeable difference in how they feel day to day. These are often the first signs that the body is responding again, that it is no longer being held back in the same way. If this combination is overlooked, men may continue using only one part of the approach and feel disappointed when results are limited. But when both pieces are used together, consistently and with intention, the body is given a more complete form of support. And this leads to the final and most practical question. How do you actually use this combination in a way that fits naturally into your daily routine and allows these changes to build over time? 7. Using it the right way to see real results. So now that you understand why the combination matters, the next step is learning how to use it in a way that truly supports your body, not just for a few days, but in a way that builds over time. This is where many men, especially in their 60s and 70s, unintentionally lose momentum. Not because the approach doesn't work, but because it's used inconsistently or without the right timing. In clinical practice, I often see men try something once or twice and then quietly give up when they don't feel an immediate shift. That reaction is completely understandable, especially if you've already tried other methods that led to disappointment. But the body at this stage of life responds differently. It needs rhythm, consistency, and a sense of predictability. A simple and practical way to begin is to take a small amount of vinegar, diluted in water, about 10 to 15 minutes before your main meals. This allows your body to prepare, giving your blood vessels the signal to begin relaxing before digestion even starts. Then, during at least one meal each day, include olive oil and vinegar together, such as in a salad with familiar foods you already enjoy. This is not about changing your entire lifestyle, but about gently adjusting what you already do. What's important to understand is that the first changes may not be dramatic. You might notice subtle differences, feeling a bit more comfortable in your body, sleeping slightly better, or having more steady energy throughout the day. These are early signs that your circulation is beginning to respond. If this step is rushed or treated as a short-term experiment, it's easy to miss those signals and assume nothing is happening. But when done consistently, the body often responds in quiet but meaningful ways. And as these small changes begin to build, something deeper starts to return, not just physical function, but a sense of trust in your own body again, which is where true confidence begins to grow. 8. Conclusion. Rebuilding trust in your body, one step at a time. As we come to the end of this conversation, I want you to take a quiet moment and reflect on something deeper than just physical function. The body, especially after 60, becomes more sensitive, more responsive to both care and neglect. It is no longer as forgiving as it once was, and small imbalances, especially in circulation, can quietly grow into larger challenges if left unaddressed. What we've talked about today is not just about one specific issue. It's about understanding that your body still communicates with you, often in subtle ways. Changes that happen at night, moments of rest that feel different, or signals that fade without explanation, these are not random. They are early indicators of how well your internal systems, particularly your blood flow, are functioning. If these signals are misunderstood or ignored, the next 1 to 5 years can look very different. Circulation may continue to decline, energy may become less stable, and confidence, both physical and emotional, can slowly erode. But the opposite is also true. When you begin to understand what your body needs and make small, consistent adjustments, you create the conditions for stability, even improvement. This is not about chasing youth or expecting perfection. It is about preserving function, maintaining connection, and protecting your independence. It is about waking up and feeling a sense of familiarity with your own body rather than uncertainty. The most important message I can leave you with is this: your body is not working against you. It is waiting for the right support. And when you respond with patience, understanding, and consistency, even small changes can lead to meaningful shifts over time. Your future health is not decided all at once. It is shaped quietly, day by the choices you make and the attention you give to what your body is trying to tell you.